I do hope the media are listening to this, because I would like the people of Ireland to know what happens following a serious incident or death in any HSE hospital in this country. If you are unfortunate to be injured yourself, or a loved one is injured or worse, dies under the care of the HSE hospital, this is what happens afterwards. Minister, if you could give me your attention, please. A member of staff who has witnessed the incident is supposed to record the incident locally in the hospital electronic through a system called Q-Pulse. A line manager is then supposed to investigate the incident, speaking to witnesses and report the details of a serious incident to the National Incident Management System in the State Claims Agency. What I have discovered is that staff within the HSE often record the incidents locally on Q-Pulse, but the serious incidents are not always reported nationally. Therefore, there are no record kept of incidents nationally related to a certain department or member of the HSE staff within a particular hospital. This leads to the safety of the public being left seriously compromised, as missed opportunities for prevention of future incidents in the future. I found an article on the internet written by a former consultant in UHL. He refers to 140 incidents he recorded on Q-Pulse in UHL were never followed up by management. That's 140 incidents. We now have 70 medical professionals have also came publicly and said that they have also reported incidents in the hospitals, and again, nothing been done. Now, this is what the public needs to know. Even if a HSE hospital does report the incident to NIMS, the HSE jointly manage NIMS in conjunction with the SCA. The HSE is the owner of the NIMS healthcare data-related and patient safety services user incidents. The SCA has no regulatory function and does not have legal powers to impose sanctions. Next, it might be decided that the HSE that an independent investigation should be carried out onto the serious incidents, but the investigation team will be made up of past and present HSE employees and sometimes includes a member of staff from the same hospital. The HSE investigation report is then given to the coroner to refer to if there is an inquest into a death. Now, if you're not happy with the way that the incident has been investigated, you can seek help by HICWA. But again, HICWA is made up of mostly past and present HSE employees. If a doctor involved in a serious incident is reported to an Irish Medical Council, again, the Medical Council members are mostly past and present HSE employees.
Do you need to indicate how this
I will, yes. The Medical Council then seek a so-called external expert investigation, and cause this expert is usually a past and present HSE employee. If you bring a serious concern to the National Patient Safety Office in the Department of Health, there is a past and present member of HSE working there, and the Health Minister, which is yourself, Minister, is the head of the Health Service, that the same Health Minister appoints certain members of the Medical Council. I ask you, how can this system be fair and just? Where is the natural justice? The HSE investigate themselves and has its own members on every single health authority in Ireland. The HSE appears to have total control of incidents and how they are dealt with, including death. The public don't stand a chance. I am asking for a public inquiry into all serious incidents recorded locally in the UHL, and this HSE incident record system is not fit for purpose is dangerous and unreliable. After public inquiry, I will be calling for an external body to investigate all serious incidents going forward in the health system in Ireland that does not involve any past or present HSE members. Minister, I asked you for your help on more than one occasion, and I'm asking for your help now as Minister of Health. We have serious incidents that are being reported and are not being investigated afterwards. We have serious incidents that have been reported, that have been looked at by HSE employees, even if there is a serious death. I was asked recently, when I brought it up on the Dáil here, about cover-ups in UHL, and I had reporters on to me to say, could I send out some of the information that I have on this. So here is this piece now for the media to understand. I have 3 incidents put into UHL myself more than 12 months ago, and the HSE wrote to me and asked me, could I disclose the information myself, and they already have it on file 12 months. And we're looking at trying to protect patient safety. Patient safety in this country is, if there is incidents, they're reported properly, and we try for the future to protect patients. But Minister, if you're not willing to ask people from outside of the HSE network to investigate cases, we will never rectify the problems that we have in Ireland. It was done in the UK, Chair, where there was investigations done and political people pushed for it, and there was independent investigations done. And they brought hospitals to account for their mismanagement of incidents that were reported and never dealt with. So, Minister, in your position, I'm asking you now again, please, investigate UHL, investigate it with independent people, and bring people to account for mismanagement of health professionals that have come to you and come to their executive, and help them to make sure that we can stop any future deaths or serious injuries in the hospital in UHL. Thank you.